Hi guys, I am now 4 weeks post-surgery and wanted to check in with you to give you an update on how each of my 6 surgical procedures are getting along. So I am officially 2/3 of the way through my healing and I feel amazing. Let's start with a rundown of the 6 procedures that I've had. A vaginoplasty, a labiaplasty revision, stress incontinence TOT, wisdom tooth removal, teeth straightening and mole removal. So these 6 procedures, I will update you on each of them as we go. You may also notice that I am wearing some rather colourful jewellery, which is the body parts from my surgery now preserved in crystal resin. This, I think, is a really important visual factor behind the surgery that has taken place and the results achieved, because aesthetically I look exactly the same after having these 6 surgical procedures, but I am an entirely different person. So being able to see physically what was taken off of me, I think it is a really good representation of what has gone on beneath the surface. So let's start with the most major and obvious difference to my body, which is the vaginoplasty. Now, my surgeon took me from having had 2 children naturally through vaginal delivery to being pre-pregnancy. So my body has had the changes caused by pregnancy and childbirth reversed entirely. If we have a car that's been in an accident or crash repaired, it is put back to the condition that it was originally in before change took place. Now, that's not to say that anyone who has had a baby is damaged. Everybody is individual, and after having my 2 children, I didn't feel like I was hard done by. I didn't feel like I had trashed my body through childbirth and pregnancy. I felt like I was one of the lucky ones. But ultimately, changes had taken place, and my body was different to what it was before having children. Now, just as if we were to have an accident or injury, if we cut ourselves, we heal. If we lose hair, we can take supplements or have surgery to replace it. If our nails are weak, we can build them with supplements or we can have extensions. In modern day beauty, aesthetics and surgery, things can be added to our bodies that we lack or have lost with time and age, as well as being taken away from our bodies if we have put on weight or had growths in different areas. Lumps and bumps that appear can be cut off and removed. So when we look at how we use surgery from a cosmetic or a medical perspective, these surgeries are all medical surgeries, and I will give you the reasons why. Hence why my appearance has not changed as with a cosmetic surgery would be. But equally, whatever your reason for having surgery, whether it's to improve the appearance of something cosmetically or the function of it medically, we deserve the rights over our own bodies to have that freedom of choice and do what is best for us to give us a quality of life. So going through my vaginoplasty, this involved removing a part of my birth canal. This is the area inside of the vagina where a tampon would sit and where there is intercourse. So this is my birth canal, made into a beautiful bangle, indication of how much was cut away from my internal tissue, which has now been preserved. This is my actual birth canal from my surgery, which I was allowed to keep. I have not internally examined myself post-surgery. 6 weeks is when I can resume exercise and intercourse and use tampons once again. I did have a physical examination by my surgeon whilst I was still in Turkey 1 week after having had my surgery, and everything was fine and well. There is a lot of internal stitching involved in a vaginoplasty, but it's all very much kept out of the way and you do not see or experience what is going on inside. Moving on to my labiaplasty, this is the labia minora, which is the delicate parts of the genitalia that protrude from the outer labia majora. These are very sensitive for me, would chafe and be very uncomfortable. Not every woman will feel pain from this. However, many women do and suffer in silence, as I did. At the age of 30, I actually had a labiaplasty to remove my excess labia tissue, and this is what was removed then. And it regrew over several years. So this is what was removed in my second labiaplasty, my labiaplasty revision surgery. As you can see, it has regrown to almost the same size as what was initially removed. I believe this is down to a variety of factors. Being a biohacker, I have a lot of treatments for cellular renewal, so the body regrows and replenishes organs, re-strengthens and anti-ages. So it's highly possible that just as having a male circumcision where a foreskin is removed, my labia minora, which was removed through a labiaplasty, has been able to regrow. And this is excess tissue on the body that through time had lengthened. So whilst it is very rare that this tissue will regrow, it has happened in my case, and these are the results of my 2 surgeries to reduce the length of my labia minora. This means that my labia minora now sits within my labia majora and does not protrude from my body. All of the stitches are now out by week 4. Between week 2 and 4 was when they were all just clearing. I actually had my first period post-surgery, and I am an avid user of tampons because I like everything to be kept tucked away and discreet with no blood exposure or smells. Seeing as I had a vaginoplasty internal surgery as well as labiaplasty external surgery, I am not allowed to use tampons for 6 weeks of recovery. This meant I had to use sanitary towels. Now, I also have the opinion that I prefer to have no pubic hair. It's down to every woman's preference. There is no right or wrong, but for me personally, I have sensitive skin and my body is very responsive to labels in clothing, to seams in clothing, to anything excessive touching me. So I always wear G-string underwear, which is very minimal and very tucked out of the way. I don't like things digging into my legs. I don't like panty lines. I don't like things cutting into buttocks. If you were to wear thongs or briefs or bloomers. So I like just a G-string, a single band of thin material that is out of the way and very minimally invasive. Obviously, having surgery, I avoided wearing underwear until I had my period. This was primarily because I had stitches from just beneath the clitoris and my labia minora all the way around to my anus. This whole passage was stitched to completely undo what was done by childbirth, the changing of the tissue between the vagina and anus, which I never knew that there was anything that could be rectified there. It didn't look damaged. I didn't physically notice much difference. My main concern was the opening of the vagina, where obviously in childbirth you have a 10 centimeter dilation for a baby's head. And I felt that the initial entrance didn't have the strength that it once had, but the birth canal I was fine with. However, the birth canal has been reduced significantly. The entrance brought closer and tighter and more structured post-birth. So having a lot of stitching all the way internally and externally, I avoided wearing underwear. This just meant that I wouldn't snag stitches, and as pubic hair had to grow, as I could not remove this hair after surgery because the stitches were exposed, I really did not enjoy the sensation of having pubic hair. And again, there is no shame for anybody who likes this as a preference. It's an entirely normal part of life. However, I do have sensitive skin, and as I say, any texture or contact or irritation really does create a sensory overload for me, and I don't enjoy that. So dealing with pubic hair and also having to then wear underwear post-surgery and sanitary towels instead of tampons was the kind of holy grail of stimulation for me, because that's something I have always massively avoided. Actually having my period and using sanitary towels, it took around 2 days for me to sensory adjust to this, as having the contact on my labia of a sanitary towel, which is quite plasticky, a kind of coarse mesh, having that touching me really did put me on edge, and I didn't enjoy that sensation. Of course, it was not painful, it was not uncomfortable, it was just something that I really do not enjoy in everyday life, let alone post-surgery. So I had a sleepless night to start with, as I just couldn't adjust to the crinkling and movement of a bulky sanitary towel and big underwear for that to stick onto. I wore boxer short briefs, women's boxer shorts, which are kind of small shorts that the sanitary towel could stick into and tab around and attach to so it wouldn't move. So I did not sleep for the first night because I didn't appreciate the sensation. And by the second day, I was used to sitting down, moving, and not feeling as anxious about it making contact with my surgical site, my stitches, and the unwanted pubic hair that had formed after having had my surgery. Part of wearing the sanitary towel assisted the dissolvable stitches to naturally just drop away and remove from my labia minora. So as I had been showering and washing and hygiene practices, 1 or 2 stitches had come out, but actually having had the period and that contact with underwear and sanitary towels helped the final stitches to all come out. This meant that I could then remove my pubic hair, which put me straight back to my comfort zone post-surgery. So 4 weeks after surgery, depending on when your period falls, I would say you feel and look completely as if you have not had surgery. So the surgeon was incredible in his work. He kept all cuts and incisions in the natural folds of the skin. There is no hardening, there is no raised bumpiness, there are no visible stitch sites because everything is kept so neat and tidy and tucked away. So this surgery is indeed completely undetectable aesthetically, visually, and creates the most fantastic results. The aesthetics of my genitalia were not of concern to me. I was not pleased or offended with how I looked. It's a bonus that after having had my labia minora reduced through discomfort in length of tissue, they are now symmetrical. And as you can see from my surgery, one side yet again, just as before, grew a lot longer than the other side. So this has been a common factor that my body grows asymmetrically. And yes, they are both now naturally even and symmetrical. So I'm very happy with the results of that. Moving on to my wisdom teeth removal, my 3 teeth are now here on my necklace. I only had stitches to the lower wisdom tooth. I still have this one intact and the top 2 were also taken out. These stitches have now fully dissolved and disappeared. My gums are completely at ease. There is no bleeding, there is no pain or discomfort, there's no sensitivity, and I eat completely normal. The stitches were a pale bluey black colour and just lifted out across the coming weeks. As I was eating, talking, brushing my teeth, they naturally just dissolve and drop away to leave behind a closed over gum. The bottom gums are definitely the deeper, wider holes. This is why they are stitched, whereas the upper gums are just left open to naturally heal. And it's been a very quick and easy procedure to have and also recover from. I am now on aligner number 3 of 22 for my teeth straightening. And now, because I have healed predominantly from my wisdom tooth extraction, there's no swelling or tenderness, there's no ache in the jaw where it was removed. I can speak and eat normally, so that when I now apply my new aligners at the start of every 10 days, the sensation of wearing them subsides so quickly. There is no ongoing tenderness. I would say within half an afternoon to perhaps 10 hours, I've adjusted to the maximum tension of applying the new aligner, and by that afternoon, evening, it feels like I don't have them on anymore. I wear them for around 22.5 hours per day, just taking them out for my 3 meals. And instead of drinking lots of tea and coffee that would stain my teeth and cause me to pull the aligners out to have that drink, I'm drinking more water and staying hydrated, which is a really good conscious health option, as I would typically have several coffees a day beforehand, and it's definitely reduced my caffeine consumption and given me a better diet, I would say. So the procedure itself, the treatment is passing nice and quietly and calmly in the background as I get on with my life. Moving on to moles, you can see the 4 moles removed in my ring here. They have actually healed so beautifully. I have just a tiny pink area of skin where each one was removed on my neck also and the back of my ribs. A lovely fresh pink piece of skin, and I think it is such a minimally invasive procedure to have. I have the peace of mind that these moles now will never cause me to have skin cancer. They cannot grow abnormally. They have been removed in their entirety. Where I would normally catch them, they would bleed and they would be agitated or scab for a few days. That risk is completely gone. So for peace of mind, it's incredible. Finally, my stress incontinence, TOT, has been life-changing, and every week that passes, it just becomes more and more effective. So going to the toilet now, I have no urgency. Before, I would have my hairs would stand on end on my arms, I would get cold sweats, I would feel like I was going to wet myself, like my bladder would burst. It was a very, very uncomfortable urgency that would leave me in great distress. Every time I would leave the house, I would go to the toilet before leaving the house, in case you need to go and there's not one available, as soon as I arrived. And also whilst I was out, my days were planned around where is the nearest toilet and how can I access this. I also have Ehlers-Danlos syndrome, which means that there is an urgency to go to the toilet more because of connective tissue disorders, as well as hypermobility. So a lot of the tissue in my body is very flexible. It does not behave the way that it should. And upon approaching my doctors in the past, asking for help with stress incontinence, they had always said, it's brain training. You are going because you are anxious. You are not going because you have to. And actually having the physical surgery itself, privately, not through the NHS or my doctors, it was cured in an instant. All of that pain, discomfort, urgency instantly went away. And when I do go to the toilet, previously it was like throwing a glass of water down the toilet, a big splash all at once, very severe. Now it's a calm, controlled stream, which I never would have been able to do before. I would not have been able to hold it back in such a way. So it does show me that physically the problem is solved and I no longer have this issue. It is really such a game changer. And when we look at the quality of life that we have, when we can do the things we love without being held back by symptoms and sacrifices that we make to our lifestyle, to be able to go and run, to be able to jump on a trampoline with the children, to take part in sports, to laugh, to cough, to sneeze without any stress incontinence causing the leakage of urine, really does make such a difference. So I am incredibly happy that rather than going down the route of using sanitary towels and stress incontinence pads to live with the side effects, I have instead gone to the root cause and solved it. The solution is there. I am free from those symptoms now. So something that had gradually crept into my life after having the children and with age through Ehlers-Danlos syndrome, something that affects millions of women. Most women are affected by stress incontinence, regardless of if they are mothers or not. I have now removed that from my life, and I cannot tell you how wonderful that is. So those are my 6 surgeries. I hope that you will continue to follow me on my journey as I have 2 more weeks until my full surgical recovery of 6 weeks. At this point, I will be able to go to the gym once more, which I'm very much looking forward to, as well as resume sexual intercourse. I think this is a very important part of our lives as women, whether you are single, married, or in a relationship, that you have control over your body. We do not have to accept a loss of sensation, a loss of control, a loss of pleasure in our lives. We deserve to live life to the fullest. And just as we take care and love all of the things in our lives, from material possessions to loved ones, if people are sick, if something is injured or damaged or starts to deteriorate, we look to fix and repair it. Let us also reverse the symptoms and damage caused by childbirth as women. I think it's really important that we address this. We speak about this openly and honestly without shame, and have the ability to find this safe space to improve our quality of life, which then extends and overflows into everything that we do. So thank you all for joining me at this 4-week mark of my surgical recovery, and I look forward to checking in with you at week 6.